Welcome, everyone.
Hi, great. Yes. Sorry, I just hopped on from another meeting. Are we ready to get started?
Yep, perfect timing.
Yeah, perfect timing.
All right. Well, thank you, everyone, and welcome to this month's homeroom community of practice on partnering with your continuum of care. So as always, we invite you to say hello in the chat with your name and preferred pronouns, your district and role, and something you're looking forward to. So again, you can do it in the chat, but I'm Amanda Wilson. I use she, her pronouns. I'm from COHHIO. I'm the Youth Housing Initiative Director, and something I'm looking forward to is lunch. I've been in back-to-back meetings, so I'm going to enjoy this time with you all and then enjoy some lunch. So yeah, just start bringing those into the chat as we continue along our presentation. So our regular logistical check-ins, everyone can unmute. As I always say, with great power comes great responsibility. So please stay muted when you are not speaking, but you're welcome to unmute to share. And we love to see your faces on camera if that is safe and appropriate and comfortable for you. We will send out materials after the meeting. We will have some discussion like usual, and if you're having any AV issues, let us know, but the good old logging out and logging back in tends to solve most of those. So our agenda today, we're doing our welcome and introductions right now. So we have two amazing presenters with us today from from the Mahoning Continuum of Care, and then from the Ohio Balance of State. And so they're going to talk to you about their COC. One's more urban, one is very rural. And so talk kind of about what the structure and partnerships look like, and talk a little bit about the coordinated entry process that the housing world uses. We'll have opportunity for question and answer, and then of course our breakouts and our closing time. So most of you know us at COHHIO on the Youth Housing Initiative team. Ami, did you say hi already? Do you want to say hi?
Yes, I did. Hi, everyone. Welcome again. I'm Ami Diallo. As you know, I'm one of the Youth Housing Initiative specialists here at COHHIO.
And hi, everyone. I'm Evelyn Guerin. I'm also a Youth Housing Initiative Specialist.
And I introduced myself already, so that's our team. So our two presenters today are Colleen Casa, again, from the Mahoning County Homeless Continuum of Care, and then Erica Morian, who does work at our office at COHHIO, but is the Balance of State Continuum of Care Director. So they'll be able to tell you a little bit more in their presentations about who they are and what they do. And with that.
So Erica's actually going to go first, Amanda. So we're going to.
Oh, sorry. Okay.
So
I missed that. That's what happens when you're
click through these. Just spoilers for later.
Okay, great.
Just let me know when you need me to advance.
Sure. Thanks, Evelyn. Thanks, Amanda. Thanks, Ami. And thanks for inviting me here today. I appreciate it. I guess we can go ahead to the next slide. So as Amanda was saying, I'm the COC director for the Ohio Balance of State Continuum of Care. And I want to start off by my few slides today by talking just a bit about what that term, the continuum of care, even means, and then more specifically what the balance of state, what that term means, and try to place it into a broader context. So both Colleen and I are here in our role representing a couple different federally recognized homeless response systems, And that's really where that term continuum of care comes from. That term is used primarily to refer to the particular geographic areas that have been sort of formally recognized by the federal government and other entities as the sort of specific homeless response system serving those particular communities. Within the state of Ohio, we have 9 continua of care, or COCs, as they're called for short. And you can see all of those are, all of the urban COCs are in the sort of white shaded counties. So Columbus, Franklin County is its own federally recognized homeless response system, or COC. Cincinnati, Hamilton County, same thing. And you can see that those urban communities listed there. And then within the state of Ohio, we have 80 remaining counties that aren't part of those more populated urban areas and not a part of those homeless response systems. And so those counties have all been lumped together. Literally, they are the balance of the counties in the state of Ohio. That's hence the balance of state COC terminology. But those 80 counties have been lumped together and identified and recognized as the formal homeless response system for Ohio's 80 rural and suburban counties. So that's where those terms come into play. You can move on. So within the particular homeless response system that I'm the director for, the Ohio Balance of State COC, or BOS COC, as you can see there, because we cover such a large geographic area, we've subdivided ourselves into 17 what we call homeless planning regions, so that we can better address the requirements and our coordination needs across a homeless response system as large as ours. And you can see the 17 homeless planning regions listed there, and those are current and up to date and accurate. Within our 17 homeless planning regions, as we already mentioned, we have our 80 counties have each fall into one of those regions. And across our 80 county homeless response system, we have well over 400 distinct programs that are addressing and responding to homelessness within our COC in some fashion. So we're a large system. Although we're rural, we're very large. Move on. So just to help kind of set the stage and build the foundation a little bit, I wanted to briefly talk about the key and primary responsibilities of the homeless response systems across the country. And these responsibilities and requirements are primarily dictated by the federal government, specifically the U.S. Department of Housing and Urban Development, or HUD. And HUD dictates these responsibilities really because they are the federal entity who's responsible for providing federal funding to homeless response systems to help them address and respond to homelessness. So and that is such a large and important program that these responsibilities have are very important to the homeless response systems that we're in charge of and that we're responsible for. So each of those COCs that I outlined before, just a quick and dirty list here. In general, those COCs are responsible for sort of governing the COC. That includes establishing sort of policy and decision-making bodies that determine the sort of general direction of the COC. Each COC is responsible for coordinating and operating a homeless response system. This literally includes, having policies and procedures in place for how different programs will coordinate together to respond to local needs. COCs are responsible for establishing and monitoring progress on specific performance goals and measures. They're responsible for establishing and operating what are called coordinated entry systems. Really, this really just means the formal ways in which the homeless response system coordinates to respond to the needs of those experiencing homelessness. But we'll talk more about that here in a few slides. COCs are also responsible for establishing and enforcing program standards. This is literally program standards that help guide the consistent and standardized provision of services within that homeless response system. Every system must conduct an annual housing inventory count and point in time count and report that to HUD for purposes of helping the federal government and communities understand changing patterns of homelessness. Every COC is responsible for conducting an annual gaps analysis to understand where the needs are and what those needs are. And then they're also responsible for designating and operating what's called a homeless management information system, which is really the sort of centralized database into which all client level data is entered for those folks who are receiving services from the homeless response system, and that data in turn is used at the aggregate level to help our system track our performance on certain project and system level goals. Reinforces our coordinated entry system and helps us on an ongoing basis engage in that gaps analysis and also understand what our resources and our needs are. Move on. So for today, we were specifically asked to talk more in depth about this term coordinated entry and our homeless response systems, coordinated responses to homelessness. And specifically, we're asked to talk about this, I think, in part because it's the coordinated system is what folks in the educational system are probably most likely to sort of come into contact with. And that's the most helpful piece that you all likely need to be aware of in order to do your jobs well and to, further this coordination with our homeless response systems. So this term coordinated entry, sometimes, in talking with folks who work within the homeless response systems, you might also hear them use terms like coordinated entry or coordinated intake or coordinated assessment. But really what this all means is just the process or the system that coordinates entry into, movement within, and ultimately exit from a homeless response system. Can move on. So across the country, like I said before, HUD requires that every federally recognized COC or homeless response system that they must design and implement this sort of coordinated entry system. HUD further requires that every coordinated entry system address these 4 key components of coordinated entry. So every system needs to identify how people in crisis will access the system, what that looks like. We have to advertise it affirmatively for their fair housing. Every system, coordinated entry system across the country, has to identify how they will engage in common assessments to help further and deepen our understanding of the level of service needs of the folks that we're serving. Every COC's coordinated entry system must also outline a set of policies and procedures that guide our prioritization decision-making, and prioritization decision-making specifically for our limited permanent housing resources. Our homeless response systems never have enough resources to serve every person who is eligible for them and who wants assistance. Therefore, we have to make decisions about who gets prioritized and who will not be served. And then lastly, every COC's coordinated entry system must have policies and procedures in place that guide how we engage in sort of the referral making process at different points within our system to ensure that it's consistent and standardized and equitable. Next slide. So this is intended in the most simple way to kind of illustrate how the coordinated entry system for the balance of state continuum of care operates. Again, in the most simple way. So the first thing I want to highlight is there on the far left, you see a little orange circle labeled access point. So within the balance of state continuum of care, if someone is experiencing a housing crisis and wants to seek assistance, they start with an access point, and I'll talk more about what that is in a second. That access point agency then engages in what we call a diversion screening with that person or household seeking assistance. This just means we're exploring any other options outside of the homeless response system that household might be able to tap into to help them stay in a safe housing option, even on a limited basis, in lieu of entering into the homeless response system, which again, never has enough resources to address the need. For those households that we are not able to successfully divert, who have no other options, then you can see through that little blue circle, then they could be supported to move into a local emergency shelter program option. The dotted blue line that falls directly below the emergency shelter blue dot, that's intended to represent those folks who are living in an unsheltered location, maybe in their car or some other place not meant for habitation, and either unable or unwilling to enter into an emergency shelter. So that blue line is intended to represent the fact that we still will continue, we want to continue to work with them and try to assist them the best way we can, even if they're not able to enter into an emergency shelter. So after folks are identified by our coordinated entry system through an access point, either remaining unsheltered or entering an emergency shelter, then at a specific point in time thereafter, Our coordinated entry system response requires that certain providers complete an assessment with those folks who are experiencing homelessness within our system. We have a designated assessment tool that our designated providers are required to use, and that helps us, again, deepen our understanding about the severity of need of the folks within our homeless response system. Then moving on to prioritization, the results of that assessment tool, along with what we know about a particular household's past homelessness, any disability information, and other things like that. Those pieces of information come together to help the designated providers in a particular area make prioritization decisions about who needs to be prioritized for our limited but available permanent housing resources. And what we're always striving to do is to prioritize those with the longest homeless histories and the most serious needs for our available housing. And typically the permanent housing options that we have available in any part of our COC, either they're going to fall into the permanent supportive housing category or the rapid rehousing category. We can kind of ignore transitional housing for the moment. Permanent supportive housing project types, that is affordable housing that someone can receive for an indefinite period of time that's paired with intensive voluntary supportive services. So that resource is our most expensive and most intensive. So that tends to be targeted to households that not only have long terms of homelessness, but are also have a diagnosed disability. And then rapid rehousing is much more sort of light touch, not intensive supportive services. It is time limited. And it really looks like rental assistance paired with typically home-based sort of case management services that are both individualized to meet household need, but also fairly voluntary with some limited exemptions. And rapid rehousing can be provided to a household up to 24 months, although the more common duration is, between 3 and 6 months, I would say. So that's generally kind of like what it looks like to move through the system within the Ohio Balance of State COC's homeless response system. You move on to the next one. Yeah, and I'll provide a little bit more detail about the access point component. Again, because I think this is probably the most important thing for folks on this call to know about. So within the Ohio Balance of State Continuum of Care, again, we cover 80 counties, rural, suburban, semi-urban communities, in every corner of the state. Because we are so large, we've taken an approach to the access point component of coordinated entry system requirements, wherein we are using multiple access points across that 80 county area. We have multiple access points within each of those 17 homeless planning regions that I previously talked about. And when we were initially determining who these access point organizations were going to be, we worked with our local providers to really focus on identifying those organizations who are already kind of organically situated and to respond to local, to respond to households who were experiencing some kind of a housing or homelessness crisis. So for us, most of our access points are existing homeless service provider organizations. In fact, the vast majority of them are. Additionally, within our system, we tried to ensure that our access point agencies are available both by phone and in person as much as possible. Our hope is that makes them more accessible, but also recognizes that in some cases we only have one access point in a particular county, and it may not be reasonable for some. It's in many cases not reasonable for a household to drive all over if they even have access to transportation, looking for that access point organization. So ensuring that we have phone access for our access point providers, particularly important. And you can see that bullet there that is clearly indicating that for our victim service provider agencies, which would include those like domestic violence shelters and things like that, there is no requirement that they're available in person, where an agency is dedicated to serving victims of violence. Go on to the next slide.
Hey, Erica.
Yep.
We did have a question in the chat about the difference between PSH and TH. I don't know if you want to take that now or at the end of the presentation.
I can do it now. It's pretty easy. So transitional housing is a homeless dedicated project type that is intending to respond to someone's homelessness by providing time-limited housing up to 24 months paired with services. Transitional housing can be operated in a way where the housing is offered in a sort of scattered tenant-based model. Maybe you're using multiple apartments in a community, or it can be something that's more sort of congregate or project-based. Maybe you've got a large building and every household who's getting assistance in the transitional housing project lives in their own bedroom or their own apartment unit within that structure. I kind of moved, so that's transitional housing. It's time limited, and people are still defined as homeless when they're being served by a transitional housing project. In contrast, permanent supportive housing is not time limited. It pairs the provision of affordable housing either through providing rental assistance or providing a unit directly. It pairs the affordable housing with more intensive supportive services. And the only people who are eligible to be served in a permanent supportive housing project are those who have both a documented disability and long-term homelessness. So transitional housing is a model that's not really used very frequently anymore in homeless response systems. If we have very few transitional housing projects in the balance of state COC, which is why I kind of like moved past it. I would say it's in most cases a pretty outdated model of assistance. So last thing I think I'll say here about access points and related to the balance of state coordinated entry system. So you can see there are a lot of pins on this map. Within the balance of state continuum of care, we have about 120 organizations that have been designated as coordinated entry access points within the balance of state continuum of care. All of the navy pins represent those general population access points within the balance of state continuum of care. And then the sort of olive colored, the lighter green pins, those represent the access points in the balance of state who are dedicated specifically to serving veterans. And then you can see the darker green pins are dropped in the urban COC areas so that we have the information about their access points as well. In the urban COCs, they tend to, most of them, if not all of them, tend to have just like one access point. Oftentimes there's like a hotline number and maybe an office someone can go to. It's obviously and necessarily very different in the balance of state continuum of care. So the link on this slide is, that's publicly available. So we published this map of homeless response system access points on the COHHIO website, and you could find it specifically through the sort of main page for the Ohio Balance of State Continuum of Care. It's an interactive map. Anyone who's seeking assistance or trying to connect someone else to available homeless resources in their community could go to this map, find the pin in the geographic area that you're looking for, and you would be able to find contact information for that access point, the organization name, address, unless it's a victim service provider agency, phone number, hours of operation, etc. So that is, if you happen to be working with someone, a family in any part of the state who's indicating that they're concerned they're going to become homeless or they are experiencing homelessness, they're in extreme housing crisis, anyone could go to that map and go through the work to find an access point that would be positioned to respond to the needs of that household and could connect them directly to that access point. And actually, maybe it makes sense to come back to this slide later in discussion, but just in terms of thinking about this particular group and this particular meeting opportunity and how the balance of state as a particular homeless response system works to coordinate to address educational needs. A couple things I guess I could highlight here. Again, we're 80 counties, tons of providers. So what coordination with to address educational needs looks like on the ground in the different parts of our COC looks a little bit different in each place. However, we have established some COC-wide expectations for the balance of state. Number one is that we do have basic expectations in place and requirements that our homeless service providers are going to seek to engage with educational providers, school districts, others like that at the local level, and seek to, extend invitations to those folks to like local homeless coalition meetings, et cetera. So at least there's an opportunity for cross-system partnerships and people to get to know each other. We've also outlined encouragements and requirements around establishing formal agreements for the purposes of ensuring that our homeless response system and those providers have the ability to help address the educational needs of the folks that they're serving. So more specifically, we do require that all of our homeless service provider agencies that are serving families with children, that they designate specific staff so that they can, who are responsible for ensuring that they're supporting families to help them exercise their educational rights. So that's a requirement we've had in place for a long, long time. And then beyond that, there's also strong encouragement that our homeless service providers seek to form, again, those formal partnerships with our key educational partners to ensure that we can support our work to help the households we're serving and address their educational needs. And I guess I can stop there because I just have, just email addresses for ongoing correspondence and communication. So I think
Awesome.
I pass it on. I'll stay on for a while, obviously.
Thanks so much, Erica.
I'm just going to stop sharing really quick so everyone doesn't get dizzy when I move slides around. Just give me 1 second.
Learn that from me. I'm always clicking, just clicking, making everybody dizzy. So improvement. My dog just came in, so hopefully she'll be quiet.
All right, Colleen, the floor is yours.
Okay, thank you. Hello, everyone. My name is Colleen Costa. I am the coordinator for the Mahoning County Homeless Continuum of Care. I'm with the Board of Mahoning County Commissioners, and I use she, her pronouns.
Evelyn, can you change the mode of the slides, please? Thank you.
Okay. I may have a little bit of some repeat things from Erica, but hopefully I did my best to take all that out so you guys aren't listening to the same stuff twice. But Mahoning County is one of the urban counties that Erica explained earlier, and all of the services that we provide are for the cities, townships, and villages all within Mahoning County. HUD has assigned oh, I'm sorry. Next, I wasn't even paying attention to the slides. Thanks, Evelyn. And here's a little map. So this is just a map of Ohio with all of the counties broken down, and Mahoning County is in the navy color. Excuse me. Each year, HUD has assigned the COC with different planning and reporting responsibilities. And each year, the Continuum of Care applies for funding for all of our housing projects, which is done through HUD. And we have 6 agencies locally that receive funding. Those agencies are Meridian Healthcare, the Beatitude House, YWCA Mahoning Valley, Help Network of Northeast Ohio, Catholic Charities Regional Agency, and the Mahoning County Mental Health and Recovery Board. Mahoning County Homeless Continuum of Care has 3 parts of membership. Agencies that are funded through the COC, agencies that receive funding through our local emergency solutions grant, and then we also have membership for community organizations that either work with people experiencing homelessness or provide services that would benefit that population. Our full membership meets on a bi-monthly basis to discuss any services or any new services within our community. We also use that as a chance to talk about maybe any difficult clients or anything that we're working with, struggling to find like appropriate resources for them, or maybe, you know, something unique that would be specific to them. Most people also use it as a networking opportunity. Our meetings occur virtually throughout the year and in person, and a calendar can be found on our website. Next slide. So as Erica said, HUD does require all of our projects that receive funding through the COC and ESG to participate in coordinated entry. The intent of coordinated entry is to make the housing process easier for people who are experiencing homelessness. So they're not calling around to different agencies and sitting on multiple wait lists. This process has been moved to one centralized place in our community. We operate as a single point of access, so we have one organization that manages our coordinated entry for us. If anyone is experiencing homelessness or looking for housing in Mahoning County, they can call 211, and that'll connect you to your local 211. Excuse me. From there, the 211 worker completes an initial assessment to make sure that the person or the family is safe, and they're making any referrals or giving any information based on that first immediate need. After that, coordinated entry staff person contacts the family to complete an assessment and to determine how long a person is or has been experiencing homelessness, and to complete an assessment that's going to determine the needs of that household. Families who are designated with the highest needs in our community are assigned a housing case manager. That case manager's role is to keep in touch with the family until they are housed and support them with anything that they are able to in that time period of getting in or being added to coordinated entry and getting that referral. When one of our housing projects has an opening, they contact our coordinated entry staff person. The coordinated entry staff then contacts the family, explains the housing program that has the opening, and asks if the family would like to be referred to that program. And then after the family agrees, then the coordinated entry staff person makes that connection for the family to work with a specific housing project. Most of our projects in our community are PSH projects, which Erica's explained a little bit about, and those require a disability. We also have a pretty large rapid rehousing projects, and that project is intended for people that don't have such a high level of need or care. Next slide. All of our projects are required to have an educational liaison. And that's specific to all of our projects that serve households with children. So in our case, that actually is all of the projects that we have in Mahoning County. A project is required to designate a staff person, and that staff person ensures that the children in the family or household are enrolled in school, and then they also make any connection to any appropriate services in the community, which include early childhood, Head Start, and any other educational services. Next slide. And if you have any questions about our services here specific to Mahoning County, or how you'd like to get involved or become a member, you can contact me. Here is my email address. That's it.
Awesome. Thanks, Colleen.
Yeah, thank you to both of our presenters. I think, Evelyn, are you getting us back to our slides? I also forgot to introduce our ODE partners when I was doing introductions. I'm so sorry. We are joined by Brittany and Jordan. So I don't know if either of you want to pop off mute and say hi, or if you just want to wave, but sorry about that.
Amanda, that's no problem. I was eager to get into the content as well. It's good to see everybody.
Thanks, Brittany. Okay, well, definitely think about the questions you have as we get into the discussion. Why does your display keep swapping on you?
I think I have two screens, so it just depends on which one it's on. Sorry about that, everyone.
No, you're fine. So we're gonna get into the breakout rooms and talk about what's happening. Are you collaborating with your local homeless planning region or continuum of care? If not, what's your plan to get connected with them, and how are those collaborations going, or how would you like them to look? So I think Evelyn's going to get y'all into your breakout rooms, and we've really got a lot of time for discussion. So we'll have you in there for a while to chat, and then we'll come back and have a discussion as a group. How long do we want to do the rooms?
10 minutes is probably good.
10, 15. We'll see how folks are doing.
Yeah. All right. I just opened the breakout room, so everyone should have an option to join. Please let me know if you don't see that.
See everybody. Welcome back, everyone. I couldn't see your, sometimes I have your little microphones. I couldn't see them today. So hopefully you are having rich and valuable discussion in your rooms. And now I would love to open it up to the group for folks to share what they talked about. And I'm not going to start calling on people yet, but if nobody wants to share, then I might call on people.
I'll talk. I was telling my group I might be too involved in our COC because sometimes, but I go to all of our local and all of our regional meetings and participate, and I do the pit count for our county. But it's because we don't have a lot of people. We have one shelter, and it only serves 3 families. That shelter serves 5 counties. Our numbers were 258 last year. So 258 children were experiencing homelessness, but there's only 3 rooms at the shelter. So it's just, yeah, I'm involved because I have to advocate for our students. So, you know, we're working on it. It's work in progress. But as far as the Continuum of Care has been very good at having the schools involved, and they always want to know what's going on. So they're all very helpful. So I would say we have a good collaboration.
Awesome. Thanks for sharing that. And how, if you don't mind me asking a follow-up, like, how did you get involved? Like, what did that process look like for maybe folks on the call who don't have that level of involvement? I know every community is different, but.
Well, just invited to the meeting. Just, this is when we meet, you know, please come. So I did. So, and been going.
Awesome. Thank you.
And actually, you know, in that world, it seems like there's a lot of transition. I'm like the second longest standing member of the group. And I've only been doing this 8 years. So that says a lot, but there's a lot of, you know, there's a lot of transition.
Yeah, it's a really good point. Other folks want to share what they were chatting about or their experiences or questions while we have our presenters here?
I'll just add a couple things. So I participate in our local COC. I didn't even realize there was a regional one like Amy just mentioned. So I'd like to know more about that just to see how I could advocate for more for our community. Because we, you know, we have a domestic violence shelter, but we do not have homeless shelters in our community or county. So I would love to learn more about that to see how we could somehow advocate more. And I just planted myself in the COC because like I knew about it, and I was like, the only way that we're going to make a difference is if that my voice is heard. So and now I'm on like multiple boards and committees and things just to be able to and I was telling Scott that we've established a community forum for homeless that now has 65 members and is just like broken to subcommittees, and so that's beyond the COC as well. So I just need to know about the regional. Thanks.
Absolutely. We can follow up with you and provide you some additional information. And I love that you brought up advocacy because it is such, I know we're all busy and at capacity, but it is such like an important tool, not just at the like continuum of care level, but at the state a national level when we figure out how we can advocate to get more resources into our community. And we're gonna put something about it in the newsletter, but the Ohio Balance of State was just awarded a youth homelessness demonstration program grant that's going to be going into some additional communities. I know it's a lot. Erica, do you want to say anything about that briefly?
Sure. I like brief. It's always hard to talk about YHDP in a brief manner. So the Youth Homelessness Demonstration Program, this is another program that HUD administers to help communities respond to and address homelessness in their, federally defined geographic areas. This opportunity obviously is specifically focused on addressing homelessness among youth and young adults. It's still called a demonstration, although now this is the 7th round. So it's been going on for 7 years. This is our COC's 3rd award, actually. So essentially what YHDP means for a community like ours is that we're, through these resources, our community is given an opportunity to pull together key stakeholders in our subset of counties to analyze data, work with technical assistance providers and experts in our field, and try to understand the scale and the scope of the youth homelessness problem in the geographic areas included within our YHDP site. And we use that data to begin to define the problem. And then through this planning process, we also have an opportunity to engage with the solutions to youth homelessness, best practices, and ultimately what we'll leave at least the first 6 months of this opportunity with is what's called a coordinated community plan to address youth homelessness. And essentially this becomes our map and our plan to guide us as we move forward to use these critical federal resources to build projects that can really respond to and end youth homelessness, again, in the communities that are part of our YHDP site. So it's really special because it pairs the analysis of the data and engagement and effort to understand the need, and pairs it with resources so that you can then respond to that need that you've just defined and make as big of an impact as possible. And in rural communities like ours, the funds that come through the YHDP opportunity can really stand up youth homelessness response systems where we've had nothing before, which is why it's really, and that's what we've done with our past 2 awards, is created entirely new systems to respond to youth homelessness where nothing existed before. So these awards were literally just announced a couple weeks ago. We've not even had an initial meeting with our technical assistance team and HUD. We haven't figured, we're barely getting started. So we will be sending out more communication to our providers and our COC membership probably in the next couple weeks. So that there will be more information on our website and more information publicly available. But in terms of the planning process, if you all happen to be located in a county that's part of the YHDP site, my expectation is that at some point you should see some invitation to engage in some kind of discussion around our understanding of the need of youth homelessness, because this will be a 6-month planning and plan writing process. And it's not the youth homelessness within a homeless response system is we don't have a good handle on it because youth experience homelessness and don't necessarily access services in the homeless response system. We've learned that from our past projects. Our system doesn't address and respond to their needs the way that they need. So we have to look at lots of other systems of care to help figure out what the need really is and to help also identify and start to design and think through what impactful projects can look like as well. So that's why I'm saying I would, again, if you're located in one of the counties that's included in our YHDP site, you better be hearing from somebody as we start working through that process. And my team will be talking with Amanda and her team a lot more closely as things begin to move forward. So when we get to that point in a few months, we might be tapping Amanda's team to make sure we've got we're inviting all the right folks. Is that helpful, Amanda?
I think so. Thanks, Erica. Any questions? I know Erica's got to hop off. So I know we're scheduled to 2:15, but any last questions for Erica about YHDP or anything else that she presented on for balance of state? Okay, thanks, Erica. Oh, what's up, Susanna?
I was just waving and saying thank you.
Yeah, so other folks from the breakout rooms, things that you discussed or wanted to share about what's happening in your community. We do have a couple more minutes.
Yeah, I have a couple of things just that we've been really, really fortunate with. I think kind of marshaling some resources in terms of ARP and Evento and some of the governor's money for kids, but really in 3 of our counties, in our ESC area, we've been able to move into basically a care coordination model, which has been which has made an astronomical difference, especially in Guernsey. The statistics compared to where we started now, excuse me, in terms of kids and families are being served, it's just inspiring to me. But one of my concerns is that when your map popped up, the regional map, I'm looking at, for example, I do work in Tuscarawas County, which is region 6, and Belmont, Guernsey, which are in region 7. And I'm seeing what I think is an incredible amount of progress with no touchstone at all associated with the continuum of care at all. And so I wonder if that's related to our lack of shelters in this area. I mean, I guess I don't know how you talk about shelters that don't exist or make progress when they're not there, other than the local effort to do that. But I just find it intriguing that I'm listening to everything I've heard today and looking at what I think is some progress in terms of meeting the needs of these families and these kids in schools. And how is it I've never heard any of this before, or frankly, never even stumbled across it, other than maybe a colleague referred to it, and I misunderstood what they were talking about.
Yeah, I think you raise a great point. And I think that we have a lot of, and I mean, Ohio's a big state and there's lots going on in different parts of the state, but I'm most familiar with the balance of state because that's where I worked for a long time before moving into the youth housing initiative. And I think we have a lot of we're doing a lot of great work, and there's a lot of great work happening locally, as you identified, and we have a long way to go into making sure that we're doing the partnerships and getting people connected and educating them about the structure. I think this is just my personal opinion, but I think that the COC structure has been not community based in the past. Like, I think there's been a big effort both at all the way up at HUD and at the local level to really make the continuum of care more of a community-based process. And I don't know, Colleen, if you want to speak to that at all. I know it's different. Colleen's obviously in an urban community, but I know you've done a lot of work with your partners to get the COC to be more community based and connected with other things going on in the community. I don't know if you want to speak to that effort at all.
Yeah, I can talk about it a little bit. So, prior to me coming into my role, like the Continuum of Care, we really just kind of met within ourselves, and like our organizations that got funding primarily met. So since I've been in my role since like 2017, we've been expanding it to like doing presentations at like local organizations, having those organizations come to our meetings. And what we found was a lot of organizations have a preference and priority to people experiencing homelessness. And there was just really a gap that we really hadn't identified until we kind of started bringing everybody together. So that's how we ended up having bi-month or meetings every other month, just to kind of keep that constant engagement. I would say it's a little bit different than like Ohio Balance of State though, because I'm covering a much smaller area and really like I'm listed as the point of contact. So if someone has a question about our homeless system or how it works or how to get involved, like I'm it. But I think that there's been a shift in how HUD views the continuum of care and like what they're expecting of us as well. So
Thanks for that, Colleen. And there was a question in the chat about how to find out when folks are meeting in your community. And I would just direct folks to email course to home, our partnership at the homeless education at cohio.org email. I'm sure Evelyn or Ami can toss that in the chat. Just email us there and we can help. I know that map is available, but we can also help you get connected with, we have working relationships with all the COCs. So if you're having trouble getting connected, we can help you get connected to who your local person is, so that we can continue to improve those partnerships.
And I think too, just kind of to clarify, Amanda, like there's 2 points of contact, like for our continuum of care. So if you're working with a person who's experiencing homelessness, like they're going to call our coordinated entry system. Like that person or your organization may not necessarily come into contact with me, because like I'm not that staff person, and while I oversee the project and like the implementation and like day to day, like I'm not doing the day-to-day work on it. So I think that that's kind of a point of like distinction between you maybe are working with your homeless service providers, but then like the community engagement or community meetings, like that would kind of likely be an alternate person.
Yeah, really good clarification, Colleen. Thank you. So yeah, when you're looking at your access point map, that's telling you like where families get services, but and sometimes that's the same place that's leading the local kind of coalition or discussion, but sometimes it isn't, especially in the urban areas. So we definitely email us and we can help you get connected to who's doing the work in your community, so that you can get involved if you aren't already. Any other comments, questions, things folks wanted to share from their breakout rooms? All right, well, as you think of it, feel free to, put a hand up or put something in the chat, but I know we've really got about 10 minutes, but we can just move through our final slides. And as you're processing, of course, if you have questions, put them in the chat or you can come off mute. But we do always like to get feedback. So please, we really appreciate your feedback on these sessions, and we do use it to inform how they're structured. So even if you do it every time, that is awesome. But anytime you just have a couple minutes, we really appreciate that feedback to help us make sure these sessions are useful to you and are giving you good information and a valuable use of your precious time. And then we always love to hear what's going on in your community to put in the newsletter that comes out. So if something really exciting is happening, there's another form link and you can let us know what is going on and share with us what's happening in your community, because we want to get the word out. And there's that email again for for us at COHHIO. And again, we're happy to get you any information you need on today's topic or anything at all that we can get you connected with. And I think that's it for our content. I'll just open the floor up one more time if anybody has any closing thoughts, questions, or comments before we wrap up today. Okay, well, as always, you all are very appreciated. Thanks for your time, attention, and participation. And it's, it's a few extra minutes back from your time today. And please watch your email for the slides and communications from us, and reach out if you have any questions or concerns, okay?
Thank you.
Thanks, everybody.